Hello everyone. Today I'm going to discuss the approach to neck lump. So in this video, I'm going to talk about how to take history, what to do in examination, and how to provide management to patients who present with neck lump. Okay. So first thing first, in data gathering, the first part is history of presenting illness. So we are going to start with introducing ourselves, confirming the patient name, the patient's date of birth, and then we will begin with an open-ended question, how may I help you today? Okay, and the patient most probably will say, Doctor, I have this neck lump, and I just wanted to check it out. So we will follow up with another open-ended question. Can you please tell me a bit more about it? And the patient might tell you some details about the neck lump, and then we're going to explore some other details the patient might have missed. So you will ask about the location of the lump, where exactly the lump is in the neck, because depending upon the location, there can be different causes of the lump. So for example, if the lump is in the midline, then it's most probably because of thyroid or thyroglossal duct cyst. And if it is on the side, then it can be a lymph node, etc. Okay. So we'll ask about the location of the lump. So we'll ask the patient, can you please point out with your finger where exactly the lump is in your neck? Can you please tell me the rough size of it? And when you touch it, does it, feels soft or hard to you? Okay. So a few questions about the lump's location, the rough size, consistency, etc. Okay. And then you can ask questions like, have you noticed any skin changes over the lump? What about the surrounding area? And any other lumps anywhere else in the body? Okay. So these are important questions. Then we'll ask about the onset. So we'll ask the patient, when did you first notice it? Okay. And how has it changed over time since you first noticed it? Okay. So if it is growing very rapidly, then we will be suspicious of a malignancy, of a malignant cause. Okay. Then we'll ask about any symptoms associated with the lump. So is it painful at all? Okay, and does it cause any difficulty in swallowing or breathing? So by these questions, we are basically ascertaining whether it is causing any pressure symptoms or not. Okay, so this was about symptoms of the lump. These questions were about the onset of the lump, the course, duration, location, size, symptoms, etc. Now we are coming to differential diagnosis. So we'll ask questions relating to specific differential diagnosis. So the first diagnosis that we have on our list is reactive lymphadenopathy. Okay. I have placed it, on the top of the list because it's the most common cause of enlarged lymph node in the head and neck area. So reactive lymphadenopathy is when the patient is having an infection in the head and neck area, and there's an enlargement of lymph node because of that infection. Okay. So we'll ask questions about reactive lymphadenopathy. We'll ask the patient, do you have any fever? Do you have any flu-like symptoms? Any sore throat? Any ear pain or discharge? Any toothache? So all these questions are relating to head and neck infections. So any infection will present with fever. The flu in itself is a viral infection that will cause enlarged lymph node and sore throat, then otitis media or otitis externa, and then any tooth infection. So that was about reactive lymphadenopathy. Then the next differential on our list is thyroid mass. Okay, so thyroid mass can either be goiter or a thyroid tube. Okay, so we'll ask questions relating to increase that is hyperthyroidism or hypothyroidism, increase activity of the thyroid gland or decrease activity of the thyroid gland. So I'll ask about palpitation because in hyperthyroidism, if the thyroid gland is overacting, then the patient will experience palpitation. So I'll ask the patient, do you experience any heart racing, any change in your bowel habit? So if the patient is experiencing hyperthyroid symptoms, then he might complain of diarrhea. If it is more towards the hypothyroid side, then he will complain of constipation, then heat and cold intolerance, and any change in the voice. Okay. So this was about thyroid mass. And the third differential on our list is infection, which is another common cause of lymphadenopathy. So basically, tuberculosis and HIV are the most important things to keep in mind when a patient presents with neck lump. So for TB, we'll ask about any sick contents that have been diagnosed with TB, any history of prolonged cough or hemoptysis. Okay, so bringing the blood while coughing. HIV, HIV can also present with lymphadenopathy. So I'll ask about any risky sexual behavior like multiple sexual partner, not using safe sex, etc., and any recreational drug use. So the fourth differential on our list is basically the red flag here, and it is leukemia or lymphoma. Okay. So basically, leukemia or lymphoma will present with false symptoms, which are basically symptoms common to any type of cancer. F means fever, A means appetite loss, W means weight loss, L means lumps and bumps in the body, and S means night sweats. So the patient is already presenting with lumps, which is neck lump. We'll ask about fever, appetite loss, weight loss, and night sweats. And then leukemia and lymphoma patient, they have easy bruising, a tendency to bruise easily, and they might have a history of repeated infections because their WBCs are not working properly. Easy bruising because their platelets are dysfunctional. So these were differential diagnosis questions. Now, after asking all these questions, you will have a clue of your provisional diagnosis. Okay. Then we will ask about past medical history, which is P2. We'll ask the patient, has this ever happened before, and any medical condition that you have been diagnosed with. Then we'll ask MAFTOSA, which is a mnemonic. M stands for any medications that the patient might be using, any allergies. Family history is very important because you should ask about family history of malignancies. Okay, because a patient with leukemia or lymphoma might have a positive family history of malignancies, hematological malignancies. Also, anyone in the family is having TB, then he's having a sick contact, and you should be careful about screening for tuberculosis as well. And then psychosocial, what do you do for a living and what do you live with, etc. Then lifestyle questions, so cigarette smoking, alcohol, um, dietary habit, exercise, etc. Then you will ask about ideas, concerns, and expectations. So ask the patient, do you have anything on your mind as what might be the cause of your symptoms? Anything in specific that you are concerned about? Anything in particular that you are expecting from us today? Okay, so this is basically your ideas, concerns, and expectations. This is really important. Please never ever forget about asking ideas, concerns, and expectations in the history taking. And please also never forget about addressing the concerns in the management, okay? All right. Then examination. In examination, you will verbalize general physical examination and examination of the lump and the surrounding area. Okay. Now, coming to the management part, after taking all this detailed history and after doing your examination, especially examination of the lump and the surrounding area, this will give you clue towards your suspected diagnosis. So if the lump is, for example, hard, and on examination, if you find that the lump is hard, on inconsistency, it is immobile, and the skin is attached to it, then you are suspecting malignancy, right? So the history taking in the examination will give you idea what the cause of the lump is, okay? And then you will proceed to the management. So in management, always begin with explaining your provisional diagnosis, okay? So explain in simple words what you think might be the cause of the lump, and then address any concerns that the patient is having, okay? After this, you'll tell the patient about some investigations that you might need to do, like complete blood count, ESR, CRP, thyroid profile, etc. And the rest of the management, of course, will depend upon the specific diagnosis. So, for example, if in history taking and examination you find out that the patient has reactive lymphadenopathy, so you'll explain it to the patient that sometime when we have some infection, like any viral flu or any sore throat going on, then the lymph nodes, which are basically defensive organs of our immune system, they get enlarged because they are fighting the infection. And this is called as reactive lymphadenopathy. It's basically a self-limiting condition. And once the underlying cause is resolved, then it will resolve. So, for example, if it's viral flu, then you'll tell the patient just take lots of just take rest and take lots of warm fluids. And once your flu is resolved, then the lump in your neck will also be gone, okay? If you think that it's a bacterial infection, a bacterial sore throat, then of course you are going to give antibiotics. So this is basically reactive lymphadenopathy. You don't need to refer the patient anywhere. If you think that this patient is having tuberculosis, then you're going to explain to the patient, and you will tell the patient that you are going to refer him to the local TB team, and local TB team include doctors, nurses, and they might need to, isolate him for the first, for first week or so, and they will give him uh, medications, antibiotics that are specifically targeted against the TB organism, and then you are going to explain all the, the tuberculosis regime. We have 4 antibiotics for the first 2 months, and then 2 antibiotics for the next 4 months and all. Okay. HIV, you will refer the patient to genitourinary medicine clinic or infectious diseases. Okay. So tell the patient that you are suspecting HIV and you're going to refer the patient for further testing. Thyroid. Okay. So thyroid will depend if, if it is goiter, the patient is having hyper or hypothyroid symptom, then you will refer the patient to endocrinology. But if you feel like the patient is having thyroid tumor, then of course 2 week urgent referral to head and neck surgery. Leukemia and lymphoma, of course you will refer the patient by 2 week urgent pathway to hematology. So this was all about the neck lump and how you are going to approach it in the exam. Also, guys, if you are new to my channel and you haven't already subscribed, then please like, share, and subscribe. I hope it was helpful, and I will see you soon in the next video.